and welcome to the interview. It's great being here with you one more time. Now, it's World Physiotherapy Day, and it's observed to generate awareness about the crucial contribution physiotherapists make to society, enabling people to be mobile, to be well, to be independent. Now, it's observed on the 8th of September every year, and it was designated in 1996 as World Physiotherapy Day, and it's promoted by World Physiotherapy. Now, it basically means to restore movement, to restore function when someone is affected by an injury or illness or disability. It can also help to reduce your risk of injury or illness in the future. It takes a holistic approach that involves the patient directly in their care. This is something interesting to talk about. There are loads of news stories, and of course, there are newsmakers. This may just be one of them. Thanks for tuning in to the interview. You can, of course, put your questions in the chat section right there or in the comment section, depending on where you're watching us from. And you can also subscribe, join the conversation, and use our hashtag, the interview with Titi Oyinsan. With us today, we have Daniel, often fondly called P. Dan. He's a physiotherapist, he's also a media influencer, and he's a public speaker, as well as leadership enthusiast. Now, he's passionate about building and raising young leaders by empowering and encouraging youth, seeing their untapped abilities and utilizing them to become global impacts across board. Daniel is a recipient of the 2021 award from the Office of the Vice President, Law Society, LSS, OAU, for his exceptional to through the activities in his one, the most influential student, also IFUTSA, and also same year, most versatile student of OAU. Interesting stuff. Help me welcome P-Dan. How's it going, P-Dan?
I'm very fine. Thank you for having me.
All right. So you're a physiotherapist. You have to work very closely with people, meaning that the kind of job you do, you have to be very, very close to people. But you need to explain. I tried to explain what physiotherapy is, but I think you should explain it a little bit better than what I did.
Okay. Thank you very much for having me again. So basically, physiotherapy it's an healthcare profession. We help people to restore, to maintain and maximize their strengths, their functional movement, and as well their overall well-being. So basically, we help people to move and function throughout their lifespan. And also, I think I'll also say that. So the physiotherapy, it's the art and science of helping people to move and function. So those are the basically keywords. So any conditions that affect movement and function and your ability to do some activities that matters to you, such as your ability to roll on the bed, to sit, to stand, to walk. So any conditions that affect movement and function. So we are much interested in such conditions. So that's what physiotherapy is all about.
Okay, so you chose to talk about World Physiotherapy Day on various platforms, including this one. Now, it feels like there's not a lot of people talking about physiotherapy. Why do you think that is?
Well, I think it's basically just the awareness in Nigeria. The awareness is quite very low, and I know that physiotherapy it's a developing area of study. The world is not yet aware of it yet, and it's a limitless world of knowledge and possibilities. And I think basically in Nigeria, the awareness is just quite low, and the politics surrounding professionals, medical professionals in Nigeria, I think would play a pivotal role in such challenge that we have in the profession. So I think one is awareness, and two is the political play among the medical professions in Nigeria. Because right from my secondary school, nobody knows about what physiotherapy is. A lot of us, we are very much what's it called now? We are very much aware of medicine, dentistry, nursing, and the other medical professions. But physiotherapy, basically, the awareness is quite low, and we have like a low percentage of physiotherapists in the country. I think that's the major reason why a lot of people might not know what physiotherapy is. And I'm very sure that a lot of our old women and men, like the elderly people, they know what physiotherapy is because at one point in their lives they have to they require physiotherapy at one point in their lives. So I think amongst this my age, um, the age range, like a lot of people, especially in secondary schools and universities, even people in the universities don't know what physiotherapy is. But the major challenge is the awareness, and that's why we are creating a day like this, like September 8th of every year, to create awareness for physiotherapy around the globe.
You with me?
Yes, ma'am.
Okay. All right. Seems my connection is slow. Dr. Dan, now World Physiotherapy Day's theme for this year is osteoarthritis and the role of physiotherapists.
Yes, exactly. Yes, osteoarthritis.
Prevalent these days.
All right, I can hear you now.
Okay, so talk to us about why osteoarthritis seems a little bit more common these days.
Okay. Well, I think I will first start with what osteoarthritis is, because it's a common joint condition that affects people of 45 years of age and above, and actually characterized by pain, by functional impairment or functional limitation, inability to do some physical activity, and it's also being characterized by muscle weakness, joint stiffness, and reduced health-related quality of life. Now, quality of life means that the ability, the inability to do some certain things that you're supposed to do, like your normal daily life of living. For example, the inability to walk, your inability to drive, inability to stand up from the bed, to wear your own clothes, to like brush your own teeth, and all. And so it's a common joint condition that affects any movable joints, like most commonly the knees, the hips, and the hands. And those are the major weight-bearing joints that we have. And so it's very common. It affects. Study has shown that it affects people of 45 years and above. So they basically experience pain in the joints, joint inflammation, muscle weakness, stiffness, and so the pain is so much that they have to come to the hospital for management. And most of them, some of our patients decide to go visit a traditional medical practitioner, probably on excuse of financial constraints or beliefs or religious beliefs. And so it's very important, it's a common joint condition. And I always I want to correct this misconception about osteoarthritis, that it is not a wear and tear disease condition, because a lot of people think it's as a result of overuse of the joints, where the cartilage in the joint wear and tear, which is not so. So osteoarthritis is basically it interferes with the way the cartilage in the joint repairs itself. So that is what osteoarthritis is, not because of wear and tear. And it is not inevitable, and not everyone that is above 45 of age would experience osteoarthritis, as long as this person stays as active as possible. and perform regular exercises, the risk of having osteoarthritis reduce. So I think that is why, because there are a lot of factors that increase the risk of getting osteoarthritis. So I think basically age, and that's the first thing that would, from examining a patient. So age is the very first thing. Like, so even without going through any imaging, X-ray, MRI, or any other thing. So that's the first thing. So it's very common amongst people, elderly people, and of course it's also occurs in children. And like I said in the morning, it is called juvenile osteoarthritis. Here it's not as a result of aging. So here it's as a result of trauma to those joints. So children or young adults, they develop osteoarthritis from trauma, not as a result of aging. So I think that
Okay,
answers.
so basically, what we're talking about now, with regards to aspect of children, is trauma from what, within the womb, or rough play. Is that what you mean?
Exactly. Trauma, there are different kinds of trauma. It could be road traffic accidents, it could be fall, probably just accidental fall, or sports injuries.
Mm.
For example, a lot of like the young adults that are involved in sports, athletics, and other sports, they tend to have an increased risk of developing osteoarthritis from trauma on the field. So I think that's explainable enough.
Okay, so we often see some children with leg deformities, for instance. Where could physiotherapy come in there?
Well, okay. I think yes, physiotherapy. There are different areas of clinical practice in physiotherapy, just like we have in medicine, where we have other specialties. So in physiotherapy, we have different areas of clinical practice, such as we have cardiopulmonary, where we manage respiratory conditions. Then we have the orthopedics, we manage orthopedic and musculoskeletal conditions. Then we have neurology, where we manage stroke and the physical and the neurological deficits. Then we also have the pediatrics, which is where you came in. So we basically that we play a major role in managing pet deformities such as Erb's palsy, Klumpke's palsy. These are palsy that probably results from mishandling of the child's hand during delivery.
Okay, it does seem like we have.
And
Okay.
yeah, to manage help patients to get a normal functioning. We rehabilitate them from the abnormal state of function to the normal state
Mm.
of function. I don't know if you understand that.
Okay, so how long is this journey? For instance, I know that not every case is the same, but for instance, if you have a child with a minor um, physical deformity, it's often said that physiotherapy is a long process. For
Yes.
instance, maybe a child has a fall, maybe there's a fracture, and the leg is casted, probably for a while. But I know it does still take time for normal walking to begin. What sort of timeline are we talking about for someone watching right now that possibly has a child going through something similar?
Well, I would say that so physiotherapy is not a one-time what's it called now? It's not a one-time treatment management. It's a gradual process. We help people. We give what's it called now? We give frequency. We give how will I put it now? We give frequency to management strategies. It's not a one-time thing that okay, we give a drug and one time the conditions are gone. No, physiotherapy is a gradual is a gradual process for a patient to get through their healing, through their rehabilitation. So, for example, a child that has Erb's palsy. Erb's palsy uh, is basically an injury to the radial nerve to the nerve in the hand, which causes weakness. There's weakness, and so basically, when there's weakness, we apply our physical modalities. We apply electrotherapy, we apply massage, we apply then exercises, weight-bearing exercises to get the hand to full functioning. So it depends on the examination. It depends on what the patient, what the child presents with at the clinic. You understand? So we can't specifically say. So every of our management strategies are evidence-based because they show results. There are results. We have results. So we do it gradually. So from a child that is not able to roll, for a child that's not able to sit at the appropriate time, which is a developmental milestone of the child. So we train the child gradually such that we perform repetition of such activities so that the activity will stick to the brain of the child. And from then, the child will begin to know he is supposed to sit. And then we'll continue to do that. So then to the next one, he's supposed to stand. So we train children, we train our patients on how they are supposed to perform an activity. You understand? So there's no specific timeline. And then it also depends on the cooperation of the patient. If the patient is not cooperating, it's very sure that the patient is going to spend a long period of time. And I know that a lot of patients battle with depression, and depression alone, it's a disease. You know, that's like tackle depression first before our own management strategy treatment. You understand? So it's not a one-time thing; it's a gradual process.
Okay.
You understand? And depends on the cooperation of the patient. If the patient is not cooperating, we refer to mental health in case if depression is the case.
Okay. All right then. So my next
You understand? A lot of people battle and
my next question will be going towards how rewarding this work is. What would you say is the most rewarding thing about being a physiotherapist?
well, yes, I think it still goes back to helping people better, getting people better to their normal state, to getting people to their dreams, to their goals. You know, nothing beats seeing your patients achieve their own little wins. The little wins of a patient could be the ability to move up their hand. Another patient's little win might be the ability to stand, ability to move their body, the ability to walk. And no, it's a disability, and so nothing beats that. And I feel there's this feeling of pride when you see your patients, when you see them get better. And I think about that. Yes, I love that. Aside from working, aside from the financial part. So basically, nothing beats seeing your patient getting better, and you feel proud about yourself. Oh, wow, my patient is getting better. And every time someone walks away, you have that feeling of achievement that yes, you've been able to achieve something. You understand? I remember when I started my internship at OUTAT, I was given a patient to manage that has paraplegia, total paralysis of the lower limb, and in 10 treatment sessions, even though the patient ran away, when he noticed that he has become better, probably due to financial problem, he didn't want to come back to the hospital. So within 9 to 10 treatment sessions, he was able to walk on his own. So, which is a very good thing for me. It's a very good achievement for me.
How many sessions? How many sessions?
9 treatment sessions.
9.
Yes.
And he was able to work. Wow.
Yes.
That's amazing.
I could have actually shared the video, but due to what's it called, the medical legal guidelines, I had to follow.
I understand. So I'm so happy that you could take out time to talk to us about this. For those that don't know, Daniel, this is P Dan, or let's call him Dr. Daniel here. He is a physiotherapist, and he served in different capacities at the University Physiotherapy Occupational Students Association in OAU, also as National Association of Physiotherapy Students in Nigeria, former head of operations, and he's also been events co-organizer, building Beyond Ife 2021. You've really amassed a lot of outreach and events and activities around physiotherapy, and we can see how passionate you are about it. And honestly, all I can say is thanks for sharing this information with us, and
Thank you
keep the
very much,
awareness
ma'am.
going. If there are any other activities or breakthroughs in the world of physiotherapy, don't hesitate to share the articles with us, and maybe we can jump on a call and we can
All
talk
right.
about it some more.
All right.
What do you
Thank you
think?
very much, ma'am. Thank you very much, ma'am.
Thank you so much for joining us, Dr. Dan. Thank you so much. All right,
That's
then. At this point, I would just like to say that physiotherapy is something that can be helpful for people of all ages, with a wide range of health conditions, including problems affecting the bones, the joints, soft tissue, things like back pain, neck pain, pain, sporting injuries, apparently even brain or nervous system, which affects movements, resulting from stroke, multiple sclerosis or MS, or Parkinson's disease, heart and circulation. Such rehabilitation after a heart attack, lungs and breathing and things like that. There's so much that physiotherapy can help to improve. It can help to improve your physical activity while helping you prevent further injuries as well. Now, it's provided by specially trained and regulated practitioners called physiotherapists, like we have had here today, Daniel Olubunmi. Now, he's extremely passionate about building and raising young leaders, and if you are in that space and you were able to watch today, I suggest you connect with him and see how you can also impact your world. Thank you so much for tuning in. It's been a really interesting interview today. Until I come your way next time, thanks for watching. Or should I say thanks for listening? Depending on where you're listening from.